Dr. Tom Roselle live right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio on this beautiful Sunday afternoon. It is nice out compared to what we've had, ongoingly. The wind is gone and the temperature's not real warm, but it's not too bad either. Give me a call, 888-630-9625. That's 888-630-WMAL. Perhaps you've had a problem and you've tried and applied and come up with the same old. Nothing that works. Well, this is the place for you to figure out how to get rid of your health problems without drugs, without surgery, and take charge of your own capacity to develop wellness. 888-630-9625. We're going to talk about an epidemic today, something that is affecting millions and millions of people, not only in this country but worldwide, and it is an epidemic. And there is no age discrimination. It affects children, it affects adults, it affects everybody in between. So what is that thing? What gives you headaches and back pain and wrist pain and migraines, and it causes you to lose vision and tactile sense, numbness, and it goes on. And it's very serious, it's very real, and it's something that if you don't do something about, and aware that over time it can be much more devastating, including increasing your risk of cancer and other autoimmune types of conditions. But in studio, we're not just going to leave it to me. I have someone who is kind of a specialist in this area because he goes out and talks to different companies and people about this particular type of problem. What we're going to be talking about and who we're going to be talking with first is simply this. We have a problem with computers. Computer pain. Computer pain, not the pain that your computer causes you because it's breaking down and it crashes and so forth, but for real, the pain that it causes you because of your postural patterns, your exposure to low-volt electromagnetic fields and so forth, and it's a real situation. My guest, Dr. Scott Lamp, one of my colleagues in our practice who has a very, very special area of interest in this area and certified to evaluate your economic status. And Dr. Scott, welcome. We're going to talk about this problem today, and we're going to see if we can put some light on. But more importantly, you're going to be our host and presenter this Wednesday evening, February the 23rd, in our office at the Roselle Center for Healing in Fairfax. And you're going to be talking about computer pain and how people can deal with it. So, my friend, yes. Tell us about this thing. This is ridiculous. I mean, when we were talking about it earlier, in our practice, we see all the end product manifestations of many different things, but workspace environments are deadly, but particularly when you add the computer, it even becomes much more so. Let's talk about that for a second.
Well, I think one of the things we'll be looking at talking about is the approaches that you go to these. There's a physical aspect that happens here, and we change our bodies to compensate what we're trying to do to get our work done. Computers and where the mouse is laid, the chairs are a big one, our monitors and where those positions are all play a part on how they have a physical taxing on our body. And then we also talk about things in regards to, as you mentioned, the EMF, the electromagnetic fields that sometimes these give off. We could be sitting in maybe in our beds working on our laptop, and you've got that right on top of you. It's point-blank range, and that can give us a lot of irritation using from the electromagnetic fields to our bodies. So we're going to go over things in this workshop where we're going to be basically saying, am I at risk? How do I take care of those risks? What are the 3 things I need to do to really make sure I'm doing the best I can possibly do? And some positional things, and you can even take an old chair and make it work for you.
It's a problem, in our office or anybody else's office, in your home and so forth, and the way people posture themselves, but also the exposure, the constant glare off the screens, the environmental impact. We know, for example, that people who have cell phones attached to their head for a long period of time are now developing or increasing the risk of developing cancers, tumors on that side of the brain. You're sitting in front of a computer screen, you have a laptop sitting on your lap, your gonads are being exposed, but your postural pattern, in addition to that, is at tremendous deficit. You're bent over, you're leaning back, your head's turned to the side, you're constantly dealing with a mouse or you're on a keyboard. And we see patients who are coming in with migraine headaches. We're seeing patients who suddenly wake up in the middle of the night with a problem. They have numbness and tingling in all parts of their body. And this is a situation that really, as I said earlier, not only affects an adult, but affects children. We're starting children on computer systems way early, and now we have this end product. And so let's talk about it a little bit. What are the manifestations really? What are the things that people say, well, I have this, but whatever. But the truth of it is that the list goes on.
Yeah, there's a lot of different things here, and I think first off is like if you had a previous injury, or let's say you're trying to take care of that, if you're not taking care of your bodily position in front of your work area, you can actually be making that profoundly worse. And if you're actually dropping your head forward, like I talk about, we're supposed to be in an upright position, but if your chin or head goes forward about 1 to 2 centimeters forward, that doubles the load on your neck. Well, what does that mean? Well, okay, all the nerves from your neck go down to your arms. So you have arms and tingling pain or numbness in the hands. It could very well be how you're sitting there, and if every time you try to go out and work out, but you go back to work going 8 hours a day at that job, you're just reinforcing the problem. And until you clear that, you're not going to be fully healthy. So that aspect is really taking care of that structure.
Repetitive stress injuries, which is utilizing the mouse and repetitive motion on keyboards and so forth, is actually the fastest growing problem in the United States. Over the last 10 years, it's increased 770%. And that goes back, that's a Business Week publication, that goes back several years ago. Today's probably even far worse than that. When you're sitting there in front of these screens and you're dealing with the mouse and your posture patterns are not optimal, the toll on you and your ability to produce and your employer's end product of not getting the work out of you is monumental. But we have to realize that when a patient comes in and they're complaining of whatever it is that they came in with, eye pain, head pain, and so forth, and they say, well, I never had an accident, or there's nothing going on, but we take an x-ray of their neck because we're going to examine the area of interest, and their neck is perfectly straight. The discs are narrowed down. And they said, well, I don't know how I got that. And as you said a minute ago, when your head is forward just a bit, you end up with much more problematic everything, because of the gravitational effect on the spine, than even somebody who did have a car accident.
Right. Now, I think on top of that, don't forget about the TMJ, the jaw. The jaw itself gets pushed forward, too, and it's also trying to hold and pull back. You kind of think about one of the examples I like to talk about is like imagine a column that's straight up with a bowling ball on it, and then you take the bowling ball and you lean it over 20 to 30 degrees, and that column is really fighting hard for that so the bowling ball doesn't fall over. It needs to pull it back, and those are your muscles constantly working on it. Well, guess what? Muscles move bones. And if those muscles start to fatigue, the bones start to slide, you get pressure on the disc, you get pressure on the nerves, and you create all kinds of different types of problems.
People don't really understand that the head really is the weight of a bowling ball, from a small one to a very large one, up to 15, 16 pounds.
Correct.
And that's sitting there on the shoulders, and it's putting pressure on the neck, and you have these stack of blocks, vertebrae, bones in your neck that are trying to hold that and position it. And if you move that head one way or the other, just off-centering, guess what happens? It begins to break down. It's not okay. It's a problem that can be identified, but unfortunately most physicians don't get it. We're structural people in our practice, and we look at that ongoingly. This Wednesday evening, Dr. Scott Lamp will be your host and your presenter in the education program. He's going to be talking about pain, workplace pain, things due to computers. And so if you've thought, you're on that computer and you're working too hard, and all of a sudden your shoulders hurt, your head hurts, your eyes hurt, your headache, your numbness, your tingling, your wrists hurt, there's a reason for that, and there's a way of getting out of pain, and he's going to teach you those principles. He's going to tell you what to do. If you'd like to join him this Wednesday evening in our office, call our office at 703-698-7117. That's 703-698-7117. If you'd like to see Dr. Scott's face before you meet him, go on to... No, you're not there yet, are you? You owe me a picture.
I'm working on it.
I'm going to work on you. I just, take that back. He's not there yet. I was going to tell you to go to our website at rosellecare.com, and we have all of our doctors there, except for Dr. Scott, because he hasn't given me his picture yet.
I had to get a good ergonomic picture in, so I'm working on that.
Yeah, right. You just haven't been to the barber lately. That's the problem. Anyway, Dr. Scott will be your host this Wednesday evening at the Roselle Center for Healing, 703-698-7117. Dr. Scott, what is How bad are these statistics? I mean, we talked about people really suffering from it. In today's society, there's more and more and more of us on computers. How bad is it? I mean, is it 1% of the population? Is it 30% of the population? What's happening now, and what's the potential?
It depends on who you're going to look at and ask for. You can get up to 75 to 80% of the population that has that. And the question is that, the thing is, we might get all fancy with all our equipment, but there's a problem with that equipment is we don't set ourselves directly how that piece of equipment is supposed to work. We can be at fault. We can actually put ourselves and start actually doing things we're not supposed to. So we can say we can buy the $1,000 chair, but then we don't readjust it, or somebody else uses it, doesn't know how to adjust it, and then next thing you know, you're right back in the same boat, but you're $1,000 in debt.
That's not a good thing. I mean, the end consequences. I had a patient the other day actually came in, and their jaw was misaligned, their temporomandibular joint, that hinge jaw that when you open and close your mouth. And they had been to the dentist, and the dentist had done some really good work for them and had made a difference in the position of the jaw. But here they were again about 2-3 months later, and they had a problem again. Well, the underlying initiator was the fact that they're a computer desk jockey. They never leave the computer. So as you said earlier, the head's forward, the jaw drops down. And now in that position, if they eat anything, or if they're chewing gum, or if they're chewing on their pencil, they're destroying the position of that jaw simply because of the postural pattern. The worst thing is it now begins to affect the spinal system. The disc spaces begin to decrease because of the gravitational effect on the spine, and the nerves get trapped, and now that's the numbness, that's the tingling, that's the weakness, that's the pain, that's where you wake up in the middle of the night and you shake your hands and you can't get rid of it. It's it's ongoing presentation.
Well, one of the things is it's kind of like insidious too. The body doesn't want to deal with pain, so it'll actually compensate. So what will happen is like, for example, let's say you have your mouse, and it's not, your elbow is supposed to be into your side of your body, not reaching out and grabbing something, because it really doesn't take any energy for your elbows to be at your side. But if your arm's up and going up against gravity, then it's going to start working harder and harder. So what will happen is, as you might notice, is your body starts shifting without you even noticing, almost on an unconscious level, that you start positioning your body so it's a little bit more comfortable, and then out of the blue, you start getting neck pain, and there's some compensations in the arm, so all of a sudden your arm might feel some pain. You might get some things in your wrist. You might even be kind of bending to the side with your body. You almost start developing upper back and low back pain, because the body won't let that go. Your computer, your brain, doesn't want to experience pain. It keeps it subsided until there's an emergency. You got to listen to those little small clues, and if you don't listen to those clues, it's going to come up and bite you.
Dr. Scott Lamp is my guest on Dr. Tom Roselle Live. We're talking about computer pain. Again, the pain that you get from working on your computers, not the ones that your computers give you. And Dr. Scott will be your host, your presenter, this Wednesday evening in our in-house continuing education program, the 23rd of February at 7:30 p.m. at the Roselle Center for Healing. If you have pain and you know or suspect that it may due to your position in your workplace, or your position in your home, in your study, or at your table, or the laptop on your pants, well, this is your opportunity. Give us a call. It's 703-698-7117, 703-698-7117. Tell my staff that you'd like to attend. Very interesting piece of information recently released, that your inability to lose weight might be due to a very specific mineral.